Good afternoon, everyone. I'm Zach Kuntz, the Planning Section Chief for the COVID-19 Haywood County incident. This is the Ops Period Briefing for Ops Period 5, which is 4/10 through 4/17. Our overall goal is to safely reduce the likely COVID-19 transmission in vulnerable populations while Maggie Valley and Waynesville. We are to utilize the policy group composed of the county and municipal executives, the public health, emergency management for overreaching guidance while closely monitoring federal and state recommendations. We are to maintain adequate financial records. We are to broadly engage and empower all applicable disciplines within the people of Haywood County directed to the effort to accomplish our goal. Please remember that we are in a marathon and that the health and wellness of the team and the citizens should be a top priority. Daily situation reports from our incident management team are due to the policy group on Monday, Wednesday, and Friday, or as otherwise directed. We are to establish a solid media connection and push continual positive public outreach. Displayed there before you is the policy group. Those are composed of the sheriff, the health director, the towns of Canton, Clyde, Maggie Valley, and Waynesville, the county manager, elected officials, and the emergency services director. Displayed before you now here is our organizational chart of our command and general staff of our incident management team. The incident management team leader is Travis Donaldson. Our safety officer is Jerry Miller. Our PIO is Allison Richmond. Our liaison officer is Wayne Morgan. Our operations section chief is Cody Parton. I'm Zach Kuntz. I'll be serving as your planning section chief. Your logistics section chief is Travis Donaldson, and your finance section chief is Julie Davis.
Good afternoon, everyone. Cody Parton, operations section chief. First, I want to start off with this brief statement. The operations section is here to help coordinate a unified response to COVID-19 and provide support to everyone in Haywood County. We will accomplish this through a one team, one mission, one family approach. We are currently in the 4th week of coordinating the Haywood County response to COVID-19 and moving into the 5th week. As we continue to coordinate this response, don't lose sight of the main goal, that being life safety by limiting avoidable disease transmissions, and we will get through this together. First, I will go over the current operations. We are maintaining a comprehensive organizational structure built of multiple organization disciplines. We have formulated multiple contingency plans based on the objectives given, and we will be exercising them next week, and I'll actually be going over some of those in the next slide. We continue to have good, effective communications with all units in the operations section. Situation reports are being issued on Monday, Wednesday, and Friday evenings, with the only exception of tomorrow. We will not be issuing a situation report due to the county holiday. We continue to do research along with medical experts on obtaining pertinent and crucial information for our plan establishment and public releases related to COVID-19. We continue to strengthen working relationships with all partners involved with a one team, one voice mindset. Next, I'll go over the contingency plan. This is just a brief table of contents. If you have any questions, please don't hesitate to reach out and contact myself, and we will try to go over those with you. I just want to highlight a few of them. At the top of the list there, you'll see the plan for a call center, which is coordinated by David Francis. The plan was created early on in this endeavor and is actually in place, and the call center is up and running and functioning off the plan that we were able to create. Another one I would like to highlight there is our fatality management plan, our disaster mortuary operations response team, or DMORT plan, which is going to be coordinated by Gary Wooten. And for our own incident command post out there at the Emergency Coordination Center, we have a very detailed list of how to address different situations that may arise within the incident command post. We also have an EMS transport plan for either persons that are highly suspected to be positive with COVID or if they have been tested for COVID, which is led by our EMS Captain Nathan Murray. We also have several essential responder plans in place, essential personnel. We have an injury and illness plan, an exposure care plan and testing plan. We was also in the final stages of finalizing a isolation facility plan for essential personnel, as well as another facility plan for those that might be impacted and would not like to wish to go home during this current situation. They would like to seek refuge somewhere else as far as essential personnel goes. We also have a fire service contingency of operations plan, which is being coordinated by our fire and medical group supervisor, Darrell Henderson. He has worked closely with all 13 fire departments inside of Haywood County to get buy-in in order to provide a continuance of operations for all those respective districts. We've also worked very closely with the hospital, Haywood Regional, for hospital surge inside the hospital proper, as well as the emergency department, and the coordinator for that is Marty Stamey. Like I mentioned before, if you have any questions or you see some of these contingency plans you would like to review, please don't hesitate to contact me. Next, I will go over the control objectives that have been established for this 5th operations period. First one being establish a plan and be prepared to operate an isolation quarantine site as soon as possible. We have a social isolation facility task force that is working diligently to activate our plan that is established in establishing the facility to accommodate the vulnerable population like the homeless and less fortunate that are unwell. The next objective is to maintain, support, and ensure safe operations of essential local government functions. We will continue good communication through our continuance of operations group to monitor improvements and changes in functions in the county and all 4 municipalities. The next is to deliver appropriate, clear, relevant, and action-based communications, instructions to public and private partners and the community utilizing a common voice. We're addressing that working through our public information officers for the most up-to-date information from all local, state, and federal resources to provide the appropriate, clear, and relevant information. Next is to monitor and report economic impacts daily. We will continue to monitor the economic impacts on a daily basis through our Economic Impact Task Force that is gathering information on the effects this virus has had on tourism, businesses, and the government. Next is to identify and implement measures to care for the basic needs of impacted communities, citizens, especially vulnerable populations affected by our requirements. We have been able to currently assist 2 prominent locations in the county that help the less fortunate, and able to provide them with portable hand washing stations to help promote personal hygiene and reduce virus spread. We will continue providing more services and logistics as soon as possible through creating a working group to address these basic needs for our communities and citizens. Next is to activate and operate the team's alternative processes and facilities for triage, testing, and screening upon approval. Working through our field response task force and testing task force, they have established and exercised a plan for the Haywood County Detention Center in reference to this objective. These folks have also done the same for essential workers, which are too many to list, like on that contingency plan that I showed you a few moments ago, but the plan is in place and ready to go for essential staff triage, testing, and screening. The next one is to work with partners to create contingency plans to address any plausible local situations not already completed. Multiple contingency plans have already been formulated, like you had saw, and they're continuing to be created and modified as needed to address these and many other plausible local situations that may arise. Next, I would like to just highlight the operations section organizational chart. I currently have a Deputy Operations Section Chief, Bill Miller. Then we have a Health and Human Services branch, which is led by Ira Dove. And in the Health and Human Services branch, we have a Human Services group, which is led by Teresa Allison and Gayla Jones. Also under that branch, we have a Public Health group, which is led by Tammy Quinn and Jeannie Harris. Next group I'd like to highlight is our Continuance of Operations group, which is led by Crystal Patterson. our law enforcement group, which is led by Don Robertson, fire and medical group, led by Daryl Henderson, and our community support group, which is led by Mike Street.
Good afternoon. Joey Miller, Safety Officer. I'll be presenting the 206 Medical Plan as well as the 208 Safety Message. The County Medical Plan includes the County Wellness Clinic. They want to remind you they're still requesting calls before visiting, and they do not have COVID testing ability. The 208 Safety Message. There is no way of determining the maximum possible number of safe reuses for an N95 respirator. Safe N95 reuse is affected by a number of variables that impact respirator function and contamination over time. These recommendations are designed to provide practical advice so that N95 respirators are discarded before they become a significant risk for contact transmission or their functionality is reduced. Discard N95 respirators following use during aerosol generating procedures. Discard N95 respirators contaminated with blood, respiratory or nasal secretions, or other bodily fluids from patients. Consider use of a cleanable face shield or surgery mask over an N95 respirator. Hang used respirators in a designated storage area or keep them in a clean, breathable container such as a paper bag between uses. To minimize potential cross-contamination, store respirators so that they do not touch each other and the person using the respirator is clearly identified. Storage containers should be disposed of or cleaned regularly. Clean hands with soap and water or an alcohol-based hand sanitizer before and after touching or adjusting the respirator. Avoid touching the inside of the respirator. Use a pair of clean, non-sterile gloves when donning a used N95 respirator. Discard your gloves after the respirator is donned and any adjustments are made to ensure the respirator is sitting comfortably on your face with a good seal. Thank you.
Good afternoon, everyone. I'm Travis Donaldson, and I'll be your Logistics Section Chief for COVID-19 Haywood County Operational Period 5. The Logistics Section is utilizing the electronic resource request form to allow for streamlined requests coming from each of the sections of your team. Each section, please let your groups and branches know that for any resource request, they must utilize the electronic request form. Please utilize a new form for each item or service that you're requesting. Completing these 213s also allows us to track our expenses as a single purchasing point. A QR code has been made available within your IEP for you to scan and download to be able to use the electronic form. Personal protection equipment, as many of you are already aware, is a scarce commodity due to the unprecedented demand on stockpiles and production globally. Our logistics section has been managing our central receiving and distribution point and prioritizing orders that come in by your request forms. Currently, we're operating off guidance for prioritization methods issued by the state. We're doing our very best to meet everyone's needs. At times, this will mean that an agency doesn't receive the full quantities that they're requesting. Unfortunately, what we have managed to procure up to now may be all we get in with any substantial volume for the next several weeks. Our logistical staff has been working constantly to find outside-the-box solutions to make sure that we're finding resources to provide the best protection for our teams helping to fight and respond to COVID-19. Please refer to your 205 for any section communication needs or questions. We're utilizing Haywood Alerts and Haywood Internal Alerts to push important information out to responders and citizens. Johnny Reese is our Deputy Logistics Section Chief, who's also managing our CRDP. Steve Marciano is our IT Unit Leader. Andrew Messer is your Communications Unit Leader. And Adriana Warrington is your Supply Unit Leader. Julie Davis is our Finance Section Chief, with Ed Salim as our Deputy Finance Section Chief, and Christian Owen as our Grants Portal Manager. Please track your time and activity via your 214, as well as tracking vehicle mileage and use time, as well as equipment use time. Track all expenses, receipts, and packing slips for each of your operational period and submit to Ed Salim, your Deputy Finance Section Chief, by Monday at 2 p.m. following each ops period. Thank you, and if you have any questions, please let a team member of our section or team know. Thank you.
Good afternoon. I'm Allison Richmond, the Public Information Officer. A couple key updates for this week. Haywood County continues to stand at 3 known cases. Those are all considered recovered at this point. We will continue to update those statistics as needed. We also continue to promote the Stay Home, Stay Safe proclamation, which has been extended through May 4th. And finally, the church services, including Easter, are not advised at this time. We want to encourage churches to continue to use Facebook or other video options for their services. Rumor management remains important. We want people to recognize and use reliable sources for their information, including the Haywood County government website at haywoodcountync.gov, which we continue to update on the coronavirus page. And the following Facebook pages: Haywood County NC, Haywood County Health and Human Services, or Haywood County Emergency Management, as well as the local media Facebook pages and newsletters. They continue to put out newsletters every week with updated information, so watch for those. If you have questions related to COVID in Haywood County, call the hotline number at 828-356-2019. And finally, we encourage you to look for Haywood County Cares messages in the local media for positive stories on how our community is coming together during this time. Thank you.
Wayne Morgan, Liaison Officer. The issue I've heard coming from the boots on the ground, our workers who are out there every day, is that they're either not getting or don't know where to get information related to the Haywood COVID-19 response efforts. My response to them is ask your supervisor. The way the management structure, ICS, works is set up, you should have one point of contact with the information flow moving through that point of contact. For you folks who are supposed to be able to answer the questions, you have a couple of options available to you. Every Friday, this operations briefing goes on, presents objectives for the coming week. These objectives have been presented. There is an identified resource that's responsible for the resolution of those objectives, and that person is your direct contact for the specifics of that assignment. There's a written document, the Incident Action Plan, or the IAP, that accompanies this briefing. Every supervisor should be receiving this document through the Everbridge Haywood alert system. An IAP, in the IAP are forms with very specific work assignments developed to address the objectives. This form is called the 204 or the work assignment list. There's also a stakeholders conference call each week through the Everbridge Haywood Alert system. You should be receiving an invitation to join the call. On this call, you receive the latest updates and will be given an opportunity to report out as well. For resource needs, you need to request up through your direct supervisor on the 213, as Travis alluded to. And that goes upstream through the logistics section for resolution. This system has been proven over time and through very difficult circumstances. Your team has been working very diligently to make sure the lines of the lines of communication are open and the foreseeable contingencies are planned for and ready to go when needed. If you're not receiving the Everbridge Haywood Alert notifications, please contact me or Andrew Messer. Our contact information is on the slide, and we'll make sure that you get on the notification list. And again, thank you for what you're doing for the citizens of Haywood County.
Good afternoon, everyone. I'm Travis Donaldson. I'll be your incident management team leader. I would first like to thank everyone that's a part of this response. The amount of selfless acts of caring and assistance that is ongoing is just as unprecedented as the virus itself. There are so many people doing extraordinary things that will all contribute to our success in this fight. We're all in this together, fighting one fight as one team and one voice. As with any incident, communication is one of our major keys to success. I want to emphasize to everyone that everyone that is a part of this response, that we must communicate with each other and we must communicate well. We all must communicate well with the citizens that we're protecting. We have to be concise and consistent so that everyone knows what they should be doing or not doing to slow the spread. Please refer to and follow the chains of command within your section to ensure that the tried and proven processes allow us to succeed on all of our fronts. If you have any questions on the structures and processes, please don't hesitate to ask anyone on our IMT staff. I want to emphasize our overall goal to our response of COVID-19. We want to safely reduce the likely transmission in vulnerable populations while not overextending the burden on our existing comprehensive medical system of Haywood County. Life safety by limiting avoidable disease transmission must be our highest priority to limit serious illness and death within our county. The next several weeks of COVID-19 in Haywood County are going to be very crucial in our efforts to minimize the spread of the virus within Haywood County. As a team, we need to be reviewing and exercising the plans that we've worked so hard to create over the past few weeks. Our area is very fortunate considering that we've had several more weeks than other areas of the country to prepare and plan, so let's continue to make good use of the time that we have. I would like to conclude today's operational period briefing with a quote from George Washington. If we desire to avoid insult, we must be able to repel it. If we desire to secure peace, one of the most powerful instruments of our rising prosperity, it must be known that we are at all times ready for war. Thank you to everyone for your tireless efforts over the past 4 weeks. Good luck and Godspeed.